We are live, senators.
All right, good morning. This is Senate Health and Welfare. It is March 3rd, and we have some members, one member on Zoom, and other members will be coming in to fill in their chairs. So we're going to begin with S36, and Eric, thank you for being here.
Sure.
So why don't you, so you introduce yourself and take us forward.
Okay. Excuse me. This is Eric Fitzpatrick with the Office of Legislative Counsel. Good morning, everybody. Here to speak with the committee about an additional, a new version of the Senate Health and Welfare Committee strike-all amendment to S36. This amendment has at least one change from the previous version that you looked at, and all the changes between this version and the one that came over from Senate Judiciary are highlighted, so that those previous ones are also still highlighted. But I think you're looking at, so far, three kind of policy questions, and whether or not you want to amend the bill as it came from Senate Judiciary in these three ways. So I can point those out to the committee if that might be helpful, just kind of walk through those three sort of decision points that I think the committee is still mulling over. And remember, this is the sort of big picture is that the first piece of this bill is adding several new offenses to the list of those offenses where an arrest can be made without a warrant in a situation where the crime took place outside the presence of a police officer. There's an existing list. I think you remember me saying that always is available during felonies, and it's always available during misdemeanors that occur when the officer is there and views it. But there's a list of, only for one of these listed offenses can the arrest be made outside the presence of the officer, when the offense took place outside the presence of the officer, and it's a misdemeanor. So the proposal is to add a few offenses to that list. And so those three, you'll recall, they involve crimes against healthcare workers in healthcare facilities, all three of them. First one, so the three are 18, 19, and 20 on page 2. No changes to 18 and 19 between the versions you're looking at. The 18 was misdemeanor assault against a healthcare worker in a healthcare facility. 19 was criminal threatening against a healthcare worker in a healthcare facility. And where the first change you'll see is an offense, the third one, number 20, which is lines 9 through 12 on page 2. So remember the initial proposal there was to add to this ability of arrest without a warrant, the offense of disorderly conduct, skipping over the highlighted language for a moment, because as originally it came over on a Senate Judiciary, it was disorderly conduct generally. So any violation of the disorderly conduct statute that interfered with the provision of medically necessary healthcare services in a healthcare facility. So the proposal is, and I'll point you to the language in a moment, but the idea is that within the disorderly conduct statute, there's several different ways in which you can prove disorderly conduct, different flavor and different elements that satisfy a disorderly conduct crime. So the proposal here you see, starting on line 9, is for purposes of this ability to arrest without a warrant, only one of those types of disorderly conduct offenses will be the type where this arrest without a warrant can be made. And that type is A1, and it's specifically the language that you see in lines 10 and 11. Sure. That just tracks the language from A1 of the disorderly conduct statute. So it's the same thing. So, and I'll read it to you just so you know. And it's also on, I know Alex posted this for you as well, so whenever you want to look at it, it's on the committee's webpage today, which is that statute 13 VSA 10.6. So I'll read it to you now, just so you know. Person is guilty of disorderly conduct if he or she with intent to cause public inconvenience or annoyance or recklessly created risk thereof. And then 1, engages in fighting or violent, tumultuous, or threatening behavior. So you see that language is exactly what's reprinted in the bill in the reference. So it's only that one, only that way that disorderly conduct can be proven. Engaging in fighting or violent, tumultuous, or threatening behavior. If that's the case, and that would exclude, just so you know, in case you don't have it in front of you, the other things that would not be proven would be making unreasonable noise in a public place using abusive or obscene language, without lawful authority, disturbing any lawful assembly or meeting of persons, or obstructing vehicular or pedestrian traffic. So those are all other ways that one can charge someone with disorderly conduct. So the proposal to think about is exclude those other ways and have it only be the type of situation where there is violent, tumultuous, or threatening behavior.
Okay, and I think that this was a recommendation that our committee was very interested in defining disorderly conduct, because we did feel it was quite broad. And I think that the healthcare advocate also advocated for a change here. I think we did that. Did you want to comment on the way the definition's been narrowed here?
Oh, sure. Mike Fisher, healthcare advocate. I think our position was to either take out the disorderly conduct, and if not, at least to do this trimming.
Yeah.
Exactly as it's.
Okay. Oh,
Can I ask Eric a question?
yeah.
Is this, because I'm not a judiciary, but is this a common, or is this a thing that has been done in other places where you just sort of divide the definition?
Yes.
Did it?
that
Okay,
Sort of the approach of sometimes only incorporating part of a definition of a given offense is not unusual.
Okay.
Yeah.
Okay. I like this better. I think I would feel more comfortable taking out disorderly conduct in general, but I'm fine with this.
Yeah, I know it's a difficult decision, but I do like this, because it does help to define if someone's fighting or violent, tumultuous, threatening behavior. Yeah. Martine, you just came on screen. Would you like to comment or ask a question on this?
I guess my question would be, why not take out disorderly conduct? I'm sorry, I know that's a big question, but.
Took out disorderly conduct, and I see Devin Green is also here with us, and this is a good time to have this conversation with folks who've been engaged in the bill from the beginning. Devin, why don't you comment from your perspective, and then Eric, I'm going to ask you a question.
Yeah, I think this strikes a good compromise and a good. Oh, sorry, Devin Green, Vermont Association of Hospitals and Health Systems. I do think this strikes a balance in getting at tumultuous, the sort of.
Devin, turn your screen off.
Yes.
Turn your video off, because we're having a hard time.
Oh, okay.
Try that.
Is that easier?
Go ahead.
Okay, thank you. Devin Green, Vermont Association of Hospitals and Health Systems. I think the disorderly conduct piece, what we really are trying to get at is, you know, there's a lot of racial terms used, racial epithets used. There can be a lot of really violent behavior that wouldn't necessarily fit in the first two categories, but is really about almost escalating to the assault and the criminal threat. And so we wanted to capture that here. I was looking to see if there was like a hate speech provision, but it seems like our hate crimes statute is more for the penalty rather than a crime. So I was hoping that this disorderly conduct piece could capture that here.
Okay, so the area between good behavior and outright assault.
That's right. And in particular, you know, we really suffer from a lot of folks having racial slurs thrown at them. And so we were hoping that this would help capture that.
We've taken out verbal abuse. So violent, tumultuous, or threatening behavior. So Eric, the consequences of taking this out completely, if we took disorderly conduct out and left in only the conditions that you had spoken about earlier, what's left? I mean, what kind of behavior then would result in a warrantless arrest?
Well, I think there's going to be some crossover, so that even without this,
Yeah.
you still have criminal threatening in number 19, and you still have assault, which also involves some threatening behavior that places a person in reasonable fear of violence, of bodily harm, I should say. So there will be some crossover. On the other hand, there may be some other areas where something might not rise to the level of a criminal threat, which is person shall not by words or conduct knowingly threaten another person, and as a result of the threat, place the other person in reasonable apprehension of death, serious bodily injury, or sexual assault. So it may not rise to that level, and that might be sort of a group of offenses that might not be.
Okay.
But as I say, I think sometimes it would be, sometimes it wouldn't be, depending on the facts. That's really a policy decision for you as to whether you want to sweep more broadly or err on the side of caution. The criminal threat.
Okay, so questions? Any questions or comments? So the question is to leave it in with this modification or to take it out. And I think let's go through the rest of this proposed amendment, and then we'll come back to it and see what folks think at that point.
Sure. So moving on to the next change to the Senate Judiciary Pass version is the addition of Section 3. This actually is part of the criminal threatening statute that I was just reading from. You see, the part I just read was lines 17 through 19 on page 2. And no changes to that piece. So the proposal with the criminal threatening statute is to add, you'll see that currently within the criminal threatening statute, there's enhanced penalties for certain threats directed against certain classifications of people, whether that be DCF workers, election workers, public servants, that sort of thing. And that exists already. So the proposal here is to add into that an enhanced penalty for a criminal threat against a healthcare worker in certain circumstances. And that would be lines 13 through 16. So you see, if you violate subsection A, that means what I just read. So it has to be the sort of threat that places someone in reasonable fear of bodily injury, death, that sort of thing. If you violate subsection A with the intent to terrify or intimidate a healthcare worker, because of the worker's previous action or inaction taken in the provision of healthcare services, then you have this additional penalty. And it's similar to language you'll see if you look above on the same page, say lines 3 to 5 or so. A similar way that the existing language works for public servants, election officials. If you violate it with the intent to terrify, intimidate, or unlawfully influence their conduct, so it's kind of tracked on that concept of you have a certain specific intent toward a certain group of people, then you could be charged with this enhanced penalty.
So what this does is it puts a fine in place for this behavior. But if we have this in here, would this also then allow for warrantless arrest if someone is making these threats or offering bodily injury and so on? Say bodily injury, probably yes. The threatening piece, which is something that's in disorderly conduct. If we took disorderly conduct, would this cover what we are taking out?
I think sometimes it would, if I remember right, the initial language is to be in a healthcare facility, right?
Yes.
So if it happened to be in a healthcare facility, then you'd have some crossover and
Right.
cover. But if not, then I don't think.
Okay, yeah, just want to clarify.
Yeah.
So this is for people who are walking to their car or in the grocery store.
Yeah, it could apply in a situation like that, right? It's
Yeah.
written broadly enough so that it's not a requirement that it take place in the facility.
Okay. All right. Did we go through it all? Or-
Sure, yeah, there's one more after that one, and the last one, I think it was the report, I believe. Yes, right, so section 4, that report on de-escalation. From
yes.
the Association of Hospitals and Health Systems, Program for Quality in Healthcare, the Medical Society to jointly report on de-escalation policies in healthcare facilities, the best practices, the types of practice currently used, barriers to training, resources needed, that sort of thing.
I think that's important to have in there. Did we put in anything around data collection? About how frequently this is used and under what conditions and who's involved? Do we have anything about that in the bill at all?
I don't believe so. Yeah, I'm looking at what the report shall include at the moment. I don't see anything specific on data.
All right,
But it's
no, I'm
certainly
gonna
nice.
suggest that we think about putting some kind of data collection. I did talk with Debbie Green about that. She did indicate that it would be possible to get some data about the people who are involved, the conditions under which they're involved, so we can get a better idea of what's happening. Go ahead, Senator Hardy. And then-
Yeah, I think data collection is a good idea. I also, one of the things that strikes me is we heard testimony that hospitals do de-escalation all kind of differently. There's not a standard, there's not a, this is how we do it across the state. And it sort of reminded me last year, we did the bill on the free care programs. We were trying to
Right.
standardize, so when you went into
Right.
any hospital in the state,
Right.
you knew what to expect for free care kind of thing. And this seems to me along the same lines, is that there needs to be some kind of standardization for how hospitals engage in de-escalation and how they train people, and that they are using best practices. This is just reporting back about to us, and I think we also should put something that hospitals have to work together to create best practices and use them. And if they exist, then have some kind of policy where they're all following the same kind of thing.
Let's turn to Devin with that question. Devin, so you heard the comment.
Yep.
Respond to that.
Sure. Devin Green, Vermont Association of Hospitals and Health Systems. I am happy to report back on best practices. As for standardization, I would just want to keep in mind that we have hospitals of various sizes and various staffing abilities, and I think it would be more effective to tailor the trainings to available resources. And so if we could work within the framework of recommendations and best practices, I think that would be more effective than standardizing and ending up in a situation where it may not be as effective for some hospitals over others.
Can I ask that question?
Yeah.
Devin, but the way that this report is right now is just a report back on these things. It doesn't say that once best practices are identified, that hospitals should use those best practices. So there's no action required, just a report. And I guess I would like the report tied to some action.
Well, it does have barriers to training and resources needed. So if you're gonna have action, it'll have to ensure that you've got the resources. So how do you want, Devin, is there a way to kind of blend those two together? Because it is a good suggestion about how do we make this happen? How do we put best practices in places in our critical care, our smaller hospitals?
It sounds like
How do we
hospitals are already
actualize it?
doing some of this.
Yeah.
It's just that they're not necessarily, maybe what they're doing is working, or maybe it's.
Well, it may not be on a regular basis either. So go ahead, Mike Fisher.
Good morning again. I guess two things. One of them is that I want to remind us that we're talking about all of this conversation so far about the report is in the context of hospitals. But the bill applies broadly.
Everybody.
And so I don't know how you're going to get data. I can totally imagine if Devin can say, we're gonna get you data on the use of this stuff, and believe it. I don't know how you're gonna get data from the rest of the healthcare system. We don't regulate it. So that's the first point. The second one is that I think, at least my concept, Devin's job is to represent all of the hospitals. My concept is that our tool for this kind of thing is VPQHC. They're the ones who can be, who sort of look across the hospital system, do the research, bring stakeholders together, and sort of develop recommendations on something like this for best practices. So I just wanted to make that point. Then push back, please, if you think I got it wrong. But
So you're suggesting that they bring back recommendations for improvements in the system with de-escalation or within different categories of hospitals?
I think a request for that kind of a feedback so that you can develop policies in the future.
Sure.
I personally would test with VPQHC in partnership with, obviously.
Devin, can you respond to that?
Yes, I think VPQHC is a great resource. And again, I think it would be good to have, I would be happy to work with them on recommendations. I do want to point out that the Joint Commission, which is sort of regulatory body over hospitals, is requiring training and de-escalation as well. So that is also something we can take a look at. But there is standardization and momentum around this. So I think the inclusion of VPQHC and the recommendations will help in terms of furthering de-escalation and trauma-informed care and all the things that we want for our healthcare providers.
Okay, so we then could modify this language a little bit. I'm going to ask Devin if you don't mind working with Mike Fisher and maybe sending some language in to us and to Eric so that we can improve this last paragraph. I know this is the first time we've really looked at it.
Happy to.
Yesterday, let's do it yesterday. No, that would be very helpful because I do think the concept, having recommendations is really important, and there are some things that can be actualized as a result of folks getting together. Senator.
That sounds good. Is it just a matter of adding, coming forward with recommendations?
It could be. I think the concept is having recommendations that can be put in place or recommendations for further policy development or recommendations for resources. I mean, there's a whole lot embedded in the current language. Eric, how are you seeing this?
I guess I'm not quite hearing what the proposal is to add. I hear the discussion, but I'm not, I think I need some more from that to draft anything at this point.
So the question that Eric is asking is, how difficult is it for action?
For what?
For action on this?
No, I was just saying, I didn't feel like I had clarity
Oh, okay.
as to what the advocates would like in this language. And so I didn't feel like I could draft anything yet.
No, but I'm suggesting that Devin and Michael get together and put something together that you could
Oh, great. Yeah,
draft up for.
yeah.
I'm
sounds
not
good.
asking you to do that.
Oh,
I just
sure.
don't know if you had any thoughts at this point.
Right.
Is that okay with the committee? That we can send these guys out to the hallway, which is what we usually do. How's that work for you, Michael?
I'm texting you now.
Oh, good. Okay, so let's do that. Senator Hardy, how's that fit with your thinking on?
That they're gonna work on something?
Yeah.
Yeah, that's fine.
Okay. All right, that'll be
Ask
good.
Mike and Devin to come up
Yeah.
with something.
Did you
Okay.
also, in addition, it sounds like that's sort of a different, you also want, I think I did get enough probably to put something in there on data collection. So I think you also wanted that as well, right?
Which one?
Data collection.
Oh, yeah,
also.
I'm trying to figure out that, how we do that. I think that maybe the hospital association, and health systems folks, in this paragraph, we could ask them to come back with recommendations about how best to collect data. And to begin Devin, you had indicated to me at one point that collecting this data would not be too onerous.
I think the recommendations on how to collect the data would be really helpful because I think it would be good to work. In talking with other people, it was sort of a conversation of who collects this data. Is it the hospital collecting the data? Is it law enforcement collecting this data? I think we want to work in concert with the Health Equity Commission on collecting the data and how it should be collected. So I think recommendations around collecting the data would be great.
Okay, so we'll put that paragraph in as well, so there'll be a two reports put back to us.
Senator,
Senator Williams first.
I want to, and maybe I missed some of it in the beginning of this, but I want to look at this through the lens of the officer involved.
Yeah.
When they show up. I understand this needs to be done. It's all well and good, but what are we going to do to protect the officer? If somebody shows up, if it's a probable cause, you're going to use somebody else's testimony. Not everybody, wants to, when it comes time to testify, wants to do it. The officer is already committed and done what he thought was the right thing.
So that's the question that would be asked over in judiciary, unfortunately. Yeah,
So we can't put anything in here.
that's not our jurisdiction, but we can talk with Senator Sears.
Okay.
Or, maybe someone who is on judiciary and ask, was this information considered? We'll do that.
I've been involved with situations like this, and
Yeah.
it's, well, I know that somebody's got your back and make a decision to do what people ask you to do.
Okay.
just Mike Fisher, a quick procedural question. When I was planning to mention BPQHC in here, I called Kathy Fulton, let her know that I was going to recommend that. So she gave personal answer to me, but I don't know whether the committee has heard from her or feels the need to. Is my
From who?
from BPQHC.
Oh, VP2HC, right. We have not heard.
And I'm not suggesting you need to because I got a positive personal response, but that was a personal response.
I'll touch base. Martine, did you have a question? Okay. All right, so where are we then? So let's go back to the decision that we started out with, the decision to make on disorderly conduct, and whether to leave in that narrower definition or to take it out completely. So I'm open for discussion. Okay, I'm happy leaving it in. I could be convinced that it could come out. I'm concerned, it is in the following sections where people might be stalked or confronted. But I think it might be helpful to have it here as an explanation of the type of behavior that can cause for warrantless arrest beyond a physical assault.
Is there an adverse effect of the PD in here? Is there any, is this a bad use of legislative process?
No, I don't think so.
No, I don't.
Eric,
No, I think it's just a policy choice. Like I said earlier, there's going to be some overlap. There's some situations that you could charge under criminal threatening that might also be disorderly conduct, but there might be some others that wouldn't be both. So I think it's really more of a policy decision, no negative consequence to having both, if that's what you want to do.
And I think if you, go ahead, Senator Hardy, you're ready to speak.
I'm on the fence about it. I'm concerned that we are making such a sort of, by including all three of these, we're making a broader. Yeah, I'm sorry, I'm not being articulate, but I think I'd feel more comfortable at this point taking out disorderly conduct and then seeing if there are cases where where we might need to tighten it up more. I'm just worried that the slippery slope of creating sort of criminal behavior, crime, criminalizing people trying to get healthcare. And I understand the testimony we've heard, and I totally understand the situation that healthcare workers are in. But by including all three of these right now, it's really taking a big jump in that direction. And I mean,
Okay.
I don't know. I mean, I could be fine with that compromise, but I'm just in general, like a little more uncomfortable with.
I think it's an uncomfortable place to be. This is the kind of place where you can think of scenarios where it works and places where it doesn't. And certainly in the testimony that we heard about all of these things. We also heard about families who were very upset and needed some restraint in some way. And the issue is allowing for the medical care to go forward. So, go ahead.
Just kind of a procedure question. Assuming this comes out in committee favorably, where does it go next? Does it go back to the judiciary?
No, it goes to the Senate floor. And then there's a judiciary proposal amendment. They would present the bill first. And then our proposal amendment would be presented second, amending their proposal amendment.
So in that process, judiciary hasn't ever looked at if this language is complicating or if it's.
They could do that. I mean, they certainly will look at that. We'll make sure that Senator Sears knows what we're doing with the add-on. But the Judiciary Committee did send us a memo and said, look at these three areas, one of which was disorderly conduct. And I think that we followed through on the HIPAA compliance and approved that. We looked at disorderly conduct, and I remember what the full amount of that.
It might have been the threatening issue. Maybe it was the threatening issue
This is
also in the memo?
de-escalation.
De-escalation.
De-escalation, which we have talked about. And so I think, the combination of having de-escalation training in place might make us feel a little bit better about having the disorderly conduct in place and vice versa. At some point, that might become a non-issue, and that'd be nice. Go ahead, Senator.
Disorderly conduct from kind of a catch-all. It supports, it's subjective, but it also supports the officer involved because what's the goal? The goal is to de-escalate if you can, but to get the individual that's causing the problem someplace other than wherever it's at, emergency department. So they can use disorderly conduct. I mean, that's pretty subjective. I'm saying that if I were the officer showing up and I knew I could use disorderly conduct because it's disruptive and causing a problem with the operation of the emergency department.
Okay, so let's land on this one. I think I'm hearing you say leave it in.
That's right.
Okay, I'm happy leaving it in. Martine, oh, you're smiling.
Yeah, this is really hard.
It is not easy.
I want to protect our healthcare workers. I want to protect patients who are trying to get care, but I'm so hesitant to give law enforcement more leeway in these situations. And I think we're just in a weird place where, you know, historically, our medical system has been very top down, has been very kind of authoritarian in some ways. And I think patients want more agency in their healthcare. And I received emails from folks who were basically speaking to that. And Mike Fisher's story about the gown, I mean, we're threading a really fine needle here, and I'm struggling. I think at this point I would be more comfortable taking disorderly conduct out. But I don't know. What's the general consensus in the room?
Okay, that's fine.
I
Senator Weeds and Senator Hardy, you.
think I'm more comfortable taking it out for now, and that if we have to re-examine it next year, we can, but I feel like we're already in opening the door, and I'm comfortable with opening it wider, but.
Senator Weeds.
No,
Oh, well.
I'm ambivalent either way.
Oh.
I really am.
Well, I think I'm gonna turn to Devin Green and ask you what your thoughts are on this in terms of what you have heard from your healthcare folks.
Thank you, Devin Green, Vermont Association of Hospitals and Health Systems. Obviously, I think our healthcare folks would prefer to keep the disorderly conduct piece in this narrowed space. I think the real difference between this and something like criminal threatening is that criminal threatening includes the means to do serious bodily harm. That's usually like a weapon, and Eric can speak more to this. And I think we do want to capture the spaces where someone is screaming, "I will murder you," or racial epithets. And I would hope that this would do that. But I will leave it to the committee to make that decision.
Okay, thank you. All right, so, it's a lot easier to take something out than it is to put something in. And so I'm going to suggest that we leave it in for now. And then when we get our final draft with the new language on the reporting piece, that will come back to this again. But I have talked with a number of healthcare workers since we started looking at this, and including my own in my own primary care office, and heard some stories that I think support leaving it in, and it's for a number of reasons. Okay, so let's do that, Eric. We'll wait for we don't have a long period of time on this bill. So Michael and Devin, if you can get together ASAP and get something back to send it.
Maybe we have. Devin and I have been texting a little bit, and maybe we need to talk, but let me just try it.
Here's what I'd like for you to do. I'd like for you to read it out loud and then give it to Eric. But I don't want to debate something that we're not looking at. So just, if you want to read it out loud so we get the concept, what's there.
You're right. Your instincts were right in the first place. Let's give us a minute.
Yeah.
Devin and I to talk.
Yeah, let's do that. Okay. And you'll get it to Eric.
And then, excuse me, so when were you thinking, you're talking about time frame? What are you hoping to do? We hoping to vote it today?
I don't know if we'll be able to vote today, but I certainly would like to look at the final language.
Okay,
and whether
sounds
we,
good.
Vote on it or not. I like to have a day to look at the language.
Right.
That's been our goal, but particularly with this one, I don't think this has not been an easy one for us.
Right. Good, so I can do a revised draft based on the language that Mike and Devin agree on and send my way, then I'll send it back to Alex.
That would be absolutely perfect. Thank
Okay,
you. Yeah.
perfect. All righty.
Okay, that's good.
Thank you, everybody.
Yeah.
Thank you.
Thank you, Devin. Okay. Here we are. Back. We'll move on to S56, the child care bill. And Katie is here. I will share with you that I am trying to work a little bit with finance and appropriations on the bill, trying to get an understanding of what the thinking is around the funding for all the pieces of childcare. So, and I've been talking with Nolan a little bit. One of my concerns is, and one of the concerns I think we're gonna face, now how it will be resolved. But one of the concerns is how can we, in this bill, raise the funds necessary to do everything that we would like, including to include total cost of care and compensation in our initial financial package. Because if we put it off to next year, then we're just going through a whole nother assessment. So I'm going to work with Nolan, the joint fiscal and others, and just see what can we do, if we can do it. We'll see where we get to. We still today have to talk with Katie about our decision-making around the, I like the hedgehog, the graph that we're looking at, the 475 or 500%, whatever, for CCFAP. Because whatever we decide on total cost of care and total compensation will influence how much money we have to raise. We're just escalating. And so if you look at the RAND report, which I spent a little time going back through that again. If you look at the RAND report, if you include all of that, it expands the amount of money that we have. So just to let you know, I'm thinking and we're working with folks to try to sort out what happens to the bill once it leaves here. So Katie, where are we?
Well, there is a draft 3.1, if you would like to look at that.
Yes.
Yes, okay.
Okay, let's do that.
This, yes.
Yeah, Alex, I don't know if we need to copy to every single bill.
Give it up too much for me, Alex. Awesome.
Some of them I do, but not all of them.
Yeah.
I think by the time, I said we'll have a different version.
Oh, okay. Good, Kate. This is the one you sent.
Yeah, send it to us.
I know, this is not fun cutting down trees. Not fun at all.
Yeah, it's not necessary. We've got used to use the-
Can I have screen sharing?
Oh.
Good morning. Then Office of Legislative Counsel. There we go, screen sharing. Okay, so this is draft 3.1 and I've highlighted the decision areas that you touched upon yesterday in a different color, so hopefully we could find them a little bit faster. So we're looking for green highlighting today, and maybe that's what I'll do moving forward, that I'll put the most recent changes in green for the committee to review. So one decision that you were discussing yesterday was the effective date of the moving the group of folks with no copay from 150 to 185. You heard testimony that it would be difficult for that to take effect on July 1, 23, and you moved that effective date out to January 1, 2024. The result of that decision is that this section 3512 has to be repeated each time it's amended with a different effective date. So I've copied that section and put this change on line 16 of page 3. So we have a whole new section 2A. It amends the same CCFAP section. It has the change that You've been discussing changing 150 to 185 for the group of folks with no copay. And this section would take effect January 1, 2024. There is another piece to this. Oops.
So are you gonna go beyond the little stars?
I was just gonna show you that in this same section, there was conversation that the electronic applications wouldn't be possible on July 1, 2023. So I've included it here to take effect on January 1, 2024. I don't know if that's the right date, but I pushed that out as part of this piece.
Okay. And, yeah, I think until we get to the nearly final draft, we probably don't need to have another paper draft. I agree with Senator Harding on that. So on the going up to page 3, where we have 185. And then we talked a little bit yesterday about, I believe it was yesterday. You can go back up to page 3.
I'm sorry.
The top number up to and including. My comment would be, if we have our graph that we were looking at, I think everyone felt comfortable with the slope up and the slope down, to go to 475, but go up to 500% of poverty. I would take out the word including, but say up to 500% of poverty. That's down a couple lines.
Are you talking about line 18?
I am.
Okay, sorry, I wasn't following.
Yeah,
So that change probably wouldn't be in this particular
in this
version of
section,
3512, because it would have a different effective date.
yes,
So I'm gonna scroll up
Yeah.
to show you the section where it would be.
okay.
It would be right here.
That's-
So you would wanna say families with an annual gross income up to and including? You don't want to
I
include.
take out the including, just put up to 500%. But that allows for us to look at this little hedgehog graph that we have with the slope down, and then to consider, as we're going forward, we can consider what we're going to include in our decision-making around total cost of care and compensation. And see what happens to that.
Wait, are you suggesting going to 500 next year?
No. No. I am suggesting for 2024 that it be 185 with no copay, and that it be up to 500%.
Right, that's what I said, for next year.
Yeah,
That's a huge jump to go from 350 to 500
It
in
is.
1 year.
it is.
And
But it is consistent, it's the 475, the little graph that we have that Joyce.
no, I understand why, but I mean, to jump that high in 1 year, that's gonna be,
It will be expensive, but it will be our policy recommendation. What I'm doing is trying to sort out how much money will we actually need. Then we're gonna have to make our final decision, but I think let's start there, and then we can always move down. The other thing is that the final decision on money is going to be made down the way. Well, remember, 500% of poverty for a family of 3 is $120,000. If we go to 475, it's in the $110,000 range, which is what is in the graph that we were looking at. So that's my recommendation at this point. And we're not going to make, go ahead.
Just a comment. I sense what Senator Hart is saying, but we try to articulate it a little bit differently. We're pushing a lot of different balls down the field.
That's right.
They all have big price tags. I think we need to decide, and again, I know we're not the finance committee, and I know our intent, I believe our intent is to put in front of them a package for them to consider. This thing would be prudent for us to show some financial prudence and hit something which is more palatable for a very important bill. But I sense that moving too far, too fast is detrimental to the overall objective. And I think that if we're trying to find something compromising, which allows us all to move this bill forward successfully, I think that we need to consider the overall cost ramifications and slow down a little bit.
So your suggestion is not to go to 500. If we look at the graph that we were all attracted to, it would be 475, which is still a hefty lift.
Well, so when we have to raise revenue to pay for this, you don't flip a switch and have the revenue available. So generally, if you're gonna raise revenue, it takes time to raise that revenue in order to pay for the
Exactly.
thing. So that's why you want to phase in things, and that was the logic of phasing it in slowly, because we need to have time to raise the revenue to pay
Right.
for it.
The message I'm getting from finance is we'd like to raise revenue this year and not have to, again, look at a big step next year. I can't tell you what our final, the finance thinking will be at this point. I completely agree with not having a huge number, but I also understand that if we're going to make any steps forward on childcare, we're going to have to, consider 425. The governor has recommended 400. That is, 41 point something million dollars. 425 will be slightly higher than that. 475 will be higher than that. And 475 is the place where we get the slope down that brings people most closely into the 10% of income range that will support people with kids. So that's where I am.
Well, I guess, Madam Chair, that what I'm trying to say is if we jump to 500 next year, we will not have the money to pay for it, no matter what finance does.
No, I
Because you
understand.
can't immediately on July 1st have, $200 million raised. So if we put in that, I hear you about wanting to go to 500, but we have to do it slowly, ratcheting it up so that we have time to raise the revenue
So
or to make the financial decisions to get there.
I understand that. I completely understand that. I'm suggesting 475. I'm suggesting that we
We won't
adhere.
have enough money to do.
We won't have enough money regardless of what we do.
Well, why don't we just phase it in?
We
so that-
already have $40 million. So what do we need to raise to get up from 400% of property, 75, adding 75%? So that's the question that I am asking, and I'm going to be looking at with Joint Fiscal and others to try to determine what is that additional amount of money. And then beyond that, what's the additional amount of money we may need to raise to put into as a total cost of care and a payment piece, compensation piece. No, we can't do it all next year, but yes, we can begin to raise the funds to have that happen. And it may be that we can identify some of those funds within the current budget. So I'm just, this is good discussion. I know we all want to be careful about our recommendations, but we also want to be aware of how we can jumpstart childcare overall. So just throwing it out there, 475. And that, the reason I say up to is because if you look at that graph, you can see that we might be able to help get to the 10% of income needed. All right, so that was just that thought. So Katie, go ahead.
Okay, so I'll just flag that for
Yeah, no, this is a huge decision. And we don't want to make it blind, so that's why we've been asking JFO for some numbers.
All right, so another new section that you discussed yesterday was sort of a presentation on incentivizing high-quality childcare. So this says that by January 15th of next year, DCF is to provide information to the two committees on proposals and opportunities to incentivize the delivery of high-quality childcare within the Child Care Financial Assistance Program.
It's hard to read.
Okay. So I'll go through it again. That by February 15th of next year, DCF is to provide information to the House and Senate on proposals and opportunities to incentivize the delivery of high quality childcare within CCFAP. So this was the language that you said you wanted something in the bill about incentivizing high quality care, but it didn't have to be a formal report. So this was my attempt to capture that.
All right,
I don't remember this. Is this because of the stars, getting rid of the
Yes.
stars thing?
yes.
Seems fine.
We all talked about it yesterday.
I made some little adjustments to the language that we went through yesterday with regard to the language the Bankers Association asked for. But I almost want to hold off on looking at it because I've sent it to DFR and they're going to have a response back to the committee. So I think it's maybe not worth going through at this particular moment. And then I've updated the effective dates to account for the new 185 date of January 1, 2024. So that's it for the changes in this draft.
The special accommodations grant.
Oh, I'm sorry.
There's some changes.
Thank you. I apologize. Yes. So this is the language we looked at that DCF proposed yesterday. This is a report back coming January 15th. And it'll look at a proposal to streamline the application for a special accommodation grant, including the suitability of moving to a 12-month grant cycle and for which populations. And then you've also added a new subdivision 4, any other proposals the department deems essential to the goal of streamlining the application process for special accommodation grants.
Okay.
Was it that?
What else?
That's it for me.
Are there any other decisions that we need to make? Bill,
I mean,
besides
the big one. You have to tackle the CCFAP amounts and dates at some point.
we also should talk briefly governance, I think.
Sure. You know, the governance piece, I guess I should just flag that you kept the language in the bill that divides DCF and the two departments, and the thinking with some of that was that there'd be more focus and attention on childcare issues if the division's responsibilities were split and there were two commissioners. Sort of the parallel piece of that was that in AOE there would be a new deputy secretary added to focus on special education and early childhood. And that piece of this bill was removed when all of the education and pre-K language came out. So I guess it's at least worth flagging if you're addressing governance on the DCF side, do you want to address governance on the AOE side?
I don't think so. I think we're gonna leave that to the other committee for now, but it hasn't been resolved yet, even though we've had 3 quarters.
Has the other committee even talked about it?
I don't know.
Has your committee even talked about it?
Not really in depth. We began to deal with the topic, began to discuss the implications. The chairman has every intent to finish this in time to support submission to bill. But it's still in play.
And I did talk with them.
Governance part of it, the part about I know you were talking about
That's
the
mostly
pre-K, but does the chair know that that's part of what they're supposed to be recommending to us?
Well, I've left it in their hands what they're recommending to us. I have talked with Senator Campion, and he is planning on having an amendment that we can put into the bill that should include, I don't know what.
Well, but if he doesn't know that's part of the scope of what they're supposed to be looking at, they're not gonna look at it.
I can't
Martine,
answer that
are
question,
you
Senator.
up there?
Martine, are you there?
Here, yeah, we can obviously bring that up, but we haven't really looked at that bill yet in Senate Ed.
Right, but there is a plan to bring us a proposal of amendment, and so every committee works at their own pace. So I will touch base again with Senator Campion to see how that's going.
Hey, Martine, as the vice chair, can you just make sure that the chair understands that it's also the piece about AOE that is new to me, that Madam Chair, that's what you wanted them to look at. So
No,
the communication on this bill and what's going on with it has been
I will
challenging.
talk with the chair of education. We'll see where he's going. So, okay, so where are we beside that with the governance structure related to childcare?
With regard to the governance structure, you decided not to move the health department piece out of the health department, so made that conforming change, but otherwise,
That decision.
well, it was, I
Yesterday.
shouldn't say a decision, I would say it was discussed and I brought it back and with a strike through and I walked through it yesterday.
It's not.
The other piece of that are children with special health needs that are currently in the Department of Health. We heard from the Department of Health and others how critical it was to maintain that for a lot of reasons, including the federal oversight. So I don't see a reason. I think that is something that the agency can consider going forward.
So if that's the case, where are we at with that language?
So let me find the right page for you. Really, the addition, let's see where we are. Okay, here it is. I'm on page bottom of 19, top of 20. This is existing language about the Department for Children and Families that has been amended to include sort of the governance separation of DCF. At the top of page 20, it says that the department shall include the divisions of child development and family services and the Office of Children with Special Health Needs. That previously had said and of maternal and child health, and that has been struck in the draft 2.1 from yesterday. And a conforming change has been made at the end of the bill, or at the end of the bill, to strike through the section that moves all of the rulemaking authority for programs that the Office of Maternal and Child Health oversees to DCF. Because if the office isn't moving, the rulemaking authority doesn't need to move.
So where in the little chart that you made, where are things at?
It is the same in this draft. It is the same with the exception that the health department piece is no longer part of DCF. It's staying with the health department.
I would think that children with special health needs would also be along with, within the Department of Health as well. I would take them out
Did we get any testimony on this directly?
from the Department of Health. And also, I think from the medical society, concerned about how these kids are being handled, and Freedom Homes was the one.
Where, so children with special needs, where is that right now?
That's right on page 20.
No, I mean, where
Oh.
is it?
Where in state
I
government,
think-
I was just wondering the same thing. I was wondering if it was currently in DCF for the health department. Sure, even as I'm saying this, I'm getting 20 emails correcting me. But I can't recall off the top of my head.
It does not sit within DCF.
Is it in it's in the health department? Or is that where it is?
Will you still, but let me phone a friend to make sure.
Yeah, I think it makes sense to keep them in the department. Okay. Any other discussion on that? Okay, so, I do think, given where we are with this, with the governance structure and especially the relationship with AOE at this point, I would strike that section on children with special health needs. And if we hear a hue and cry, then we'll go back. And you'll be happy to know that people are already talking about the Department of Economic Empowerment.
Positive.
Positive. Good thing.
You made that.
Okay, so the other piece that we were looking at, and that I'm gonna trying to talk with folks about, is increasing the eligibility of the access to more than 10 hours of pre-K for kids, and folding that into our education piece, into the education funding. So looking at what would it cost, or how would we do it if we increase those hours of availability from 10 to 20 to 30 to 40? And apparently it's not an easy thing to do. So we're going to have to sort out whether we can just do it or whether it's one of those aspirational things.
Isn't that part of the recommendations we're supposed to be getting from the other committee?
Yeah. Well, we can do it. I mean, we could do that because it will increase access within the public environment and the private environment. Oof. Yeah, it's crossover. Katie, are there any other decision points that we're looking at? Did we have new language on the total cost of care? And
Not since yesterday.
yeah, but that's coming from, is that coming from you, Deputy Commissioner?
I'm sorry.
The new language on total cost of care and the payment compensation package.
If you'd like us to, draft language into that. I don't know that I had that on my radar that we would be helping with the language.
Is that you, Katie? Are we getting that?
I haven't received any instructions yet to change
When
it,
we
but we can,
talked, I thought when we talked yesterday, we talked about having language that would have, and I know, I think that we would have, remember we were having Bright Futures and AHS and others working together to bring back recommendations
right, so
around that. So I think Deputy Commissioner Gray, it was, I think, we had that long conversation and we had people in place to look at that information and put something in here.
So that is in this draft. We walked through that yesterday and it hasn't changed since
That
yesterday.
hasn't changed.
No. We can look at it again. If you
Yeah, I'd
want
like
to
to
see
do
that
that.
again. Okay.
Let's see, before you move to the next section, I was able to confirm that the Office of Special, make sure I say it correct. Office of Children with Special Health Needs is in BDH presently. The Office of Children with Special Health Needs is in Vermont Department of Health.
Okay.
And it is the administration's position that we would like it to remain there.
Isn't those two areas are really difficult. Okay.
Okay, so this is the new section that we looked at yesterday. These are a series of 3 reports on the provider compensation and the total cost of care. I know we've gone through it yesterday, so I'll just do a high level. All the reports are due to come in November 1st, 2023. The first report is a report on the pay scale. You, in this draft, tasked Department of Labor as the lead with consultation with DCF. Yes, I'm on page 7. In consultation with DCF, AOE, Building Bright Futures, and Vermont Association for the Education of Young Children. I didn't say this yesterday, I'll tell you now. I did reach out to the Department of Labor to see if they could put anything in writing about whether they, their thoughts on this, as you had asked. They've acknowledged receipt of my email and will get back to us. So that's about as far along as that is at this point. But the request is to develop and submit a tiered professional pay scale. And the pay scale is to be designed to provide professionals who provide childcare services with compensation comparable to that received by early educators in the public school system. And then also the scale would account for professionals' credentialing and professional childcare experience.
So I had some thoughts on that. This is an opportunity for just, talking about it a little bit, but if you look at the RAND report, there is a table on page 16 of the RAND report that shows the kind of the Vermont cash earnings for child care workers, preschool teachers and elementary grade school teachers in 2019 dollars. So there is a breakout of those salaries, and it has both mean and median and then 90th percentile and 10th percentile. So there is data there that can help inform these decisions. So my question is, shall we include in the language a reference to the RAND report, since it was a heavy duty report on both total cost of care and compensation? And then if you look at the mean income, actually higher than that, the median is lower in terms of. So do we base, should we ask for that inclusion of the RAND report here? That's my only question.
Madam Chair.
Yeah.
Also on page 34 of the RAND report, they have the salaries that they use in their cost model.
Right, thank you for reminding me that. I get that as well. We don't have to reference page number.
No, but I'm just showing you the electronic with different salaries.
Thank you. Yeah, great.
And that's
Right, so it shows
what we-
proposed minimum annual salaries for 2024. So there is a ballpark figure on which decisions might be based. And then what works based on the money that can be raised. So this is what I've been thinking about in terms of what we can do here, as well as what the report would be coming back from folks before November. So my only suggestion is to include the RAND report as a resource for the decision making.
I can add a sentence that says
Yeah.
to refer to the RAND report.
Yeah. Do we want to put page numbers in? No. No one can put page numbers.
I would recommend.
Okay. All right. Yes.
This is Sarah Kenny from Let's Grow Kids. I don't know if it's appropriate for me to say this, but I had a question about this section, the language in this section specifically, which is, and this may just be me not knowing the definition of a professional pay scale, but I know the folks who've been doing this work in Vermont, looking at what a minimum compensation scale should look like, have been intentionally talking about a compensation scale so that it includes both pay and benefits, and a minimum compensation scale, so you can certainly pay people more, but not like, you know, some industries where it's like you make exactly this much at each step. But they've been talking about you can expect to make at least this much when you have this particular level of professional preparation. So the language that they've been using is a minimum compensation scale, and this talks about a tiered professional pay scale. And I don't know if that's a term of art that I just don't understand, or if there's.
So we should have some consistent language is what you're saying. We don't know what the tiered, we know what a tiered pay scale is if we get into a contract situation.
Right.
Is that what we use for making determinations about how to build?
I don't know, Katie may know, because I know you looked into the contractor situation, so I don't know what the right term
I would
is.
agree with Sarah's comment. You really need to be on the total compensation, not just pay.
Yes.
It's only half.
Yes, yeah. So making sure it's proposed minimum annual salary.
Beyond the salary, though, it includes benefits, right? So they've been talking about compensation scale, and that's a.
I was just reading
our
Rand
national.
Yeah, you're right. You're right.
So I'll refer to it as the minimum professional compensation scale. Does that sound accurate?
Yeah.
I would just say, I think that if we're comparing it to public school teacher compensation, they have a salary scale with a step system and everything, and it is just salary.
Yeah.
And then benefits are negotiated separately.
Yeah.
So I'm not sure that there's gonna be the same kind of equivalent to look at full total compensation. There might be.
Yeah.
But I think that's why we said pay, because it was really thinking about the step scales for teachers and.
Yeah, we were
just-
trying to get to that stage where we had some consistency. But for this determination, I don't know, it means going into all of the school districts. So it's a question, because the Rand report also does include up to grade 3, I think, in their modeling.
I understand Senator Hardy's comment clearly,
Me too.
but it is under a section total, referred to as total cost of care. It just somehow it needs to be folded in that what we're
Yeah.
really searching for is N numbers, not.
I mean, I'm fine with changing the language. When they're doing that kind of analysis, it might be really hard to do a comparison to total compensation without doing a lot more behind the scenes work on.
They've started digging into, so yeah.
So are you clear?
No.
No, I didn't. That's why I asked that question. I know the answer.
Well, what is the committee's preference? I think you're landing on professional, minimum professional compensation scale for professionals.
Yeah.
Provide childcare services, blah, blah, blah. Is that right?
Looking to Nolan.
So I think Senator Hardy makes a very good point, and that I think it's two different pieces, because you're creating a salary scale, then you could add extra different language about, or something about benefits, and then combine compensation. But I think they do need to be looked at individually before they look at totality. That makes sense.
What does Rand include in their
So that's a great question. I know that they look at salary. I think they have, but I have to look at the model and see if they include benefits as well. I assume they do, but I can't remember.
Yeah.
They assume a fringe rate, which is
Right.
the typical way of doing it. They, you look
Yeah.
at,
Yeah.
so you don't look at, oh, how much health benefits do you get, how much paid sick leave or whatever. they look at, this is the salary, and then they assume a fringe rate. I think it's like 32%, something like that.
Right.
So, and that's a much easier way of sort of doing the math, basically, is to say this, we're gonna compare salaries, and then we're gonna assume a fringe rate on top of it. And what's in that fringe rate really depends on what was negotiated in the case of public school teachers, and, you know, what is available, and, yeah.
I think one way to get at this might be two pieces where you have the group looking at salaries, coming up with some kind of professional scale. And then when you do the total cost of care piece, you include the fringe in that piece. Because we're not trying to say what you think is an appropriate healthcare.
No,
We're trying to say
exactly.
what you think is
Yeah,
an
you're right.
appropriate Pay scale. I think there's a way of getting above both of them.
Yeah.
And then like Senator Hardy said, you create a pay scale, but then we have some calculation for fringe when we
Right.
look at total cost of care over here. Does that make sense?
And it's difficult, but I know we're asking to go geographically across the state, and look at things, but so it's all based on what negotiations are taking place in local, in districts. So it's really
Can I
hard.
just read this paragraph from,
Let me finish,
sorry.
and then, there's also, the issue around the childcare workers actually voted not to unionize, so, you know, they don't have a negotiation process at this point. So it's, yeah, so I know, and I think your suggestion is probably a good one. To do pay scale, do pay, and then look at, total cost.
so they use a 26% fringe rate.
Was that what it is?
Yeah, so the cost model also assumes a commensurate package of fringe benefits consistent with the Vermont, with VACE's advancing early childhood education as a profession task force 2021 recommendations. This includes employer contributions shared with the employee for health, dental, vision insurance, employer contributions for retirement and short and long-term disability, and paid time off of 30 days, combined vacation, illness, personal time off, all as documented in the task force report. For the employer, this package of fringe benefits plus other employee paid taxes is modeled as a 26% fringe benefit rate. I think that's how we have to do it. Like,
Yeah,
you
I
can't
agree.
say total compensation, you have to do pay plus fringe.
That's fine. I think that's enough information. I mean, you know, in the corporate
It's
world,
here.
it's not that hard. We understand pay scales, and we have compensation factor for benefits.
Fringe rates,
And we move.
what's budgeted.
Exactly,
Yeah.
so it isn't that hard, and that's why I brought it back up, because I think we can do it, we might be able to do something that informs how much money we need to raise this year, so by referencing the RAND report process for determination of pay, then will that be sufficient? And I'm looking, no.
I don't think so if you want. I think you need to be more specific. I think you can add a sentence that says, group working on this, use the RAND report to inform your decision. But I think you need something like, and assuming or accounting for fringe.
Okay,
In A, subsection A is thinking, see, the tiered professional pay scale shall account for professionals' credentialing and professional childcare experience, and shall account for or assume a fringe benefit, something like that.
include,
And shall include a fringe benefit.
as modeled.
Where are you trying to amend? I was putting it in A, subsection A,
Yeah.
the very last sentence. It says, the tiered professional pay scale shall account for professionals' credentialing and professional childcare experience.
What are you thinking?
Well, I think the language is fine.
You like that?
I think it's enough.
Shall
Yeah, I
account
do too.
for,
I mean, we've got people listening here who are actually gonna be engaged in helping with this through.
I don't think you need to reference the RAND report. I think it's a given. I think the groups they don't need to be told. to do it.
Resources? Well,
But I don't think they need to be told to do it. I think they're gonna use the report as a resource, but I mean, it's their call.
I don't know.
Okay.
I think I'd like to name it,
Okay.
but I could be outvoted on that. Are you okay with our naming the RAND report?
I think the clearer you can be about your intent, the better.
All right.
I stand corrected.
Okay, that's good.
I think maybe you just have it, as a separate section about, or separate, sentence.
Okay.
Or just say, and the addition of, appropriate fringe benefits rate.
Thank you.
The more I look at this, it seems that that this information is accessible, pretty accessible, not rocket science. I've done it before and really easy. Yeah. Okay. Does that help?
Yep, I'm gonna add a sentence that directs the group to look at the RAND report when they're working on developing this pay scale. And then the last sentence will read, the tiered professional pay scale shall account for professionals' credentialing and professional child care experience and shall include the addition of an appropriate fringe benefit rate.
Okay.
Does that sound correct?
Right.
Okay.
I'm trying to sort out with that. We want pay scale. Now, the next question I would ask is, would we also like, or is this some, would we also like an analysis of the total based on the work that's in the bill, that's not in the bill yet, but potentially is in the bill on CCFAP? Do we, I can hear the answer already, but would we want to have development of a proposed budget necessary to achieve the goals, I guess would be in the bill? Now, I'm looking past you, Katie.
Would you be able to clarify why you
How
would
much
need
money
that?
would we have to raise to make this all happen? As we're looking at the pay scale and total cost of care.
Is that,
It's not anywhere in the bill. It's a question I'm asking. And I guess I'm asking it to everybody sitting here. No one is.
What's the question?
Huh? Well, let's just leave that question for now. Back to it later. I mean, that's an appropriations question. You know, how much do we have to raise to accomplish all the goals of the bill? But this is important. Okay. That's our question that we'll be asking.
What are we asking? Are we asking now or are we asking?
We can ask it any time,
I
right?
mean, I think it's certainly relevant to the entire success of the bill.
Right, of course it is. Yeah. I'm just throwing it out there because it is a question that will be the lift for us and yeah, all. Okay. Okay. I'm going to ask Chris Delia is here. Chris, have you looked at, you want to state your name for the record, have you looked at the language that Katie put together?
Yes, Madam Chair. Good morning. For the record, Chris Delia, President, Vermont Bankers Association. Thank you for the opportunity to testify. I just wanted to be available in case you had any questions. I know Katie had sent the information over to DFR. I had a conversation with them yesterday. Certainly let them speak for themselves, but they did not indicate any problems, but you should hear that directly from them. I just want to be clear that it is the discussion you're having about expanding access to childcare services and benefits is expanding greatly in the state of Vermont, rightly so, under this bill. So the reason I got involved was because of the access to financial records. And I know that was in existing statute. but it's also highlighted in this bill. And from the time that it existed in statute, the world has changed regarding privacy regulations, and we're dealing with our customers' data. So our intent is just to have a system that our customers give consent to allow that information to be shared with the agency, and that we have the necessary language in statute for sharing that information with the agency or department. I'm honestly not sure if we're creating a new Department of Economic Empowerment, whether they're the ones that are going to be handling it, but ultimately we appreciate the work you're doing. We know that the state government wants to get access to financial records of those who are applying. And the language, the intent behind the language is to make sure that that can happen to meet the needs of the agency, the applicants, but also very much the needs of the banking industry, because that information is considered private and protected under state and federal regulations. So I greatly appreciate your consideration in this matter.
Thank you, Chris. And I think that, Katie, if you reached out to DFR.
I have.
Yeah, okay, so we should get, I think, if we get a memo back from them affirming the language or suggesting changes, we'll carry that into the bill. So thank you for reaching out, reminding us of that little section of the bill. Sometimes it's forgotten.
Thank you, Madam Chair. Appreciate the opportunity.
All right, any questions for Chris Delia? Bankers, okay. Okay, this is great. I think we're having some good conversations, and I think we're making improvements to the bill to go along. We'll, I think we will come back to the bill after town meeting week, and we'll try to put some finishing touches on it, including where our CCFAP will end or be for 2024 and then for 2025. And hopefully we'll have some information at that point about how much we can do and how much we can aspire to do going forward. So we'll leave it for now. Katie, I was wondering if we could switch gears for just a few minutes on S47.
Sure.
Okay, and we do that closer. So,
So we don't get 6 today?
pardon me,
We don't get 6 today?
I think we're, yeah,
Okay.
unfortunately.
Okay, sure.
Oh, Cheryl Mitchell is here, and she's going to talk about, she's on Zoom. So before we go to, oh, at 10:30. But she'll be talking about S56.
Yes.
An extension to non-citizens, yeah, okay.
Is that?
Cheryl Mitchell will be here at 10:30 to comment on the section on non-citizens in that bill. Thank you. We have a new draft.
You have a new draft. So again, Katie McLeod, Office of Legislative Counsel. This is a new draft of S47. You received testimony, I can't remember if it was this week or last week, they're all starting to blend together. We received testimony, some suggested changes from folks who are qualified mental health providers. And this draft incorporates their changes. I also had a conversation over email with Dylan Burns yesterday, because I had a concern listening to the testimony that they would like for, they would like, oh gosh. They would like mental health professionals to be able to transport, but not be required to do the transports. And I didn't think the language clearly reflected that. So she and I went back and forth a bit to try to capture that a bit better. So changes are highlighted in yellow in subsection B. We have language that the law enforcement officer may take a person into temporary custody, period. The law enforcement officer or a mental health professional, if clinically appropriate, may transport the person to a hospital, police barracks, or another safe location. So that's the language to try to capture the fact that a mental health professional might only be doing the transport if it's clinically appropriate. So it gives that person a little bit more discretion to determine if they're going to do the transport. And then with regard to restraints, they requested the following amendment. Striking out the sentence that had originally been proposed about if a law enforcement officer or mental health professional deems it necessary to use restraints, soft restraints shall be considered as a first option. And instead, the proposal is that a law enforcement officer shall have soft restraints available for use as a first option, and mechanical restraints shall not be used as a substitute for soft restraints if the soft restraints are otherwise deemed adequate for safety.
Okay, and this, we did hear this in testimony.
Yeah, this is from their slides, this
Yeah.
last piece, and then this earlier piece
That's from them.
was a conversation she and I had trying to capture the fact that sometimes mental health professionals may be doing the transporting, but it's not required of them.
The only hesitation I have is in the next bit, not the transport bit, but that the law enforcement officer shall have, if they don't have, that's the only, it's the shall that kind of, I believe, trips up a little bit. I'm not-
Yes, you're right, and I asked Alex to reach out to public safety folks to get their take on that language.
We have completed our task. Sorry for the interruption.
All right, so that's on S36. All right, so yeah, so shall, let's look at that. The fact of the matter is, we would prefer that our mental health patients not be transported using mechanical devices, but rather soft restraints. The question is, how available are they, and how do we make them more available if they're not? Well, we need to hear from our public safety folks before we can actually make a decision about what language to have right there. Yes.
That device is not something that they're normally going to have to deal with unless they go to a facility where they're going to be required to use those. So I'm just looking at the kit that the enforcement people are going to have to carry. If every medical facility had those available, I think that'd be that there.
We're not talking about the north, so we're talking about the law enforcement officer in the field.
Yeah.
And so I think to the chairwoman's comment that we just need feedback from them on what language would be appropriate. So
What can we do? Yeah,
certainly a first option, but if they don't have it, shall requires that.
where are we? Have we gotten a reply yet?
I have not gotten a reply.
Okay, all right, so we'll put, I guess we're gonna have to postpone that discussion, but
I
we
just
know
wanted
about it.
people to consider the kit that the officers have to carry.
Yeah. Well, the other thing is that right now, mental health counselors are working with local police departments. And I know in particular my district, I'm sure yours as well. And so there are officers who are trained to deal with mental health situations. And it might be that those folks are the ones who could add soft restraints into their kits for those. Everyone should have. Okay. We're good.
Okay.
Thank you. We still have a question and answer on this one. I'll try and get that resolved. So we'll either take full testimony in here or I'll get a letter explaining the issue so that we can deliberate when we get back after our town meeting. Before we 10:15. Martine, are you okay with that? Remembering that you're out there.
Yes, I am. Thank you.
All right, this is good. we have a little time, and I'm gonna give us a break in just a minute. Katie, I just had a thought.
Good
She
try.
thought she could just. she thought
That's so
she could. Do you, how could you reach out to Morning Fox and the agency of public safety and to John Campbell at the sheriff's and state's attorney's office and show them that language and ask them the question of the availability of soft restraints in municipal or in state public safety office or in the, to the county. Yeah.
I can, and I'd be happy to. I'm wondering if Alex might be able to reach out with them.
I think if Alex reaches out to those two and copies you,
That would
me,
work. Okay.
get that.
Sorry, give me the names again.
Yeah, Morning Fox at DPS and John Campbell at the state, what is he, state attorneys?
Yeah,
Send them a copy of the amended version of S47 and ask them about the availability of soft restraints for state and municipal
to look at how
law enforcement officers.
that we can talk about it, but I think that might help. That might help with this.
Thank you. Yeah, thank you, Alex.
Yes.
Appreciate that.
Good, yeah. Okay, so before we take a little break, two things. One, this is a resolution that was brought to us by the Nursing Association for declaration of National Skilled Nursing Care Week, May 14th through the 20th, and then September 10th through 16th is National Assisted Living Week in Vermont. It's a resolution, and it came to House Human Services and to our committee. I'm just looking for signatures from our committee if you'd like to sign on. That's it. All kinds of that. I thought it would be nice for our committee to support the nurses. Martine, you're not here, but I can save it for you.
Okay.
The other thing is we're going to come back and look at S18, and I'd like for you to consider your position on S18 so that we can possibly have a motion and vote on that bill, because we've been through it now a bit. And then S37 is still in appropriations, which I will be trying to nudge out of that committee. That's where we are at. Okay, Alex, take us off live, please.